Thanks very much. And I'm not going to just talk about CyHi, I'm actually going to talk about health in general and health across the Wheatbelt. So as it says in my title, I'm the project director for the Southern Inland Health Initiative, which is a $500 million more than $500 million, as Minister Redmond said this morning, which is part of the WA Country Health Service, which is part of the Department of Health. And over the last 5 years, I've had the, or 3 years, sorry, we've got a 5-year project. I've had the opportunity to be the project director for that project. And it's been a really good opportunity to work in the Wheatbelt and work really closely with people like the Development Commission, local government, and patients like who are represented at District Health Advisory Committees. So we've done a lot to actually start to roll out the project, but what I'm going to do today is actually talk more about the key issues from a health perspective that are facing the Wheatbelt, some of the key challenges that we have, some of the reforms and the response that WACS is providing to deal with these health issues, and also some of the future and the innovations and what technology can do, particularly about e-health and what we call telehealth. So before I launch into all that, I just want to sort of take you back a little bit to what what we call in public health land the population health sort of issues that face the health system, that sort of drive the health system or drive the illness in people. And these things that are up on the board here are called the social determinants of health. They've been developed by the World Health Organization a number of years ago, and they still remain very current in that those sort of things are things that all of us have a role in and all of us can have something to do with. And it relates to beyond just the health sector of doctors and nurses and hospitals. It relates to things like transport, addiction, employment, vocation, accommodation in particular. So all those sort of social issues have a direct impact on people's health or ill health. And those are all sort of things that we need to sort of be looking at from a bigger picture level as to how we can actually all contribute towards the good health of our communities. But from a health perspective, so the leading causes of death amongst Wheatbelt residents, which is always a good place to start, we can see there that these are the sort of basically just taken from the data that tells us that about 15% of people die from heart disease, 6% from lung cancer, and right through to complications from diabetes. And the significant thing here really is that the rates in the Wheatbelt for road trauma is about 3.7 times higher than the state average, and the rates of complications for diabetes is about 3.8 times higher than the state average. So from the rest of it, you're pretty well on track with the rest of the state, but from those perspectives, you know, those are things that we should be focusing our effort on. So why are people going to hospital? So between those years, that sort of 4-year period, there was over 240,000 emergency department visits across the sites in the Wheatbelt. That's a lot of people, seeing a lot of patients, seeing a lot of doctors, seeing a lot of nurses on a regular 24/7 basis. And the main reason why people are presenting is for those sort of things that are listed there, from chemotherapy through to obstetrics. And those presentations are no different from anywhere else that you would see in a similar regional environment. Some of the key challenges that we face, and these are the sort of things that people from the Wheatbelt are hospitalised more for, and it really relates to chronic disease. And chronic disease is like the emerging or the real epidemic that we've currently got facing us right now, with a whole range of things that are often preventable, or people can actually help to prevent, and it's often related to lifestyle choices that people make, such as eating too much, smoking, drinking too much, those type of things. What happens when people have a chronic disease is it means that they actually need to access health services more often. So if we can do things to prevent people developing chronic diseases, then we can prevent the need for acute services, and we can keep people well longer, and you don't have to go to hospital or access other services. But they're just sort of the key reasons why people are admitted. And we've already heard this morning today about some of the key challenges from the ageing perspective. This graph shows you that the top one's really the state, and it's showing you that at the moment there's about 12% of the population is aged 65 and over, and by 2056 that'll be about 21% of the population. Whereas in the Wheatbelt today we've got about 13,000 people who are aged over 65, and in just over 10 years there'll be over 18,500 people. That's a big difference in both percentage and numbers. And what that really means is because as people age, they actually do require need to access a whole range of health services. mainly to do with keeping people well, keeping people in their home, but it does it changes the dynamic of the health system to some extent. And as people get older, they also develop a whole range of chronic diseases. So my message is stay well, keep moving, eat well, don't smoke, drink in moderation, live long and happy and prosper. But it's a major issue from our perspective in the planning because we know that there's this over the horizon bulk of people who are coming who potentially have a whole range of illnesses that we'll have to manage, and we want them to stay local. One of the other key challenges in the Wheatbelt is addressing the issues to do with Aboriginal health. There's about 3,700 Aboriginal people live in the Wheatbelt population, but what's really alarming is that they're 12 times more likely to have diabetes. They're over 6 times more likely to have a respiratory problem, 5 times more likely to have cardiovascular disease, smoking, drinking, those type of things. So a very small proportion of the population has actually a disproportionately high amount of health issues affecting them. And it's one of the key challenges. One of the key challenges is about helping people access services. So if people are disenfranchised, marginalised, back to the first slide I showed you about the social determinants, they don't tend to come in and access services, they don't tend to access primary health care, and they tend to have a much shorter lifespan as well. It's one of the key challenges in Australia, I think. One of the other key challenges facing us in the Wheatbelt is mental health services. There's been a bit of this in the media lately, and I heard Minister Naughton on the radio as I was driving up here this morning, addressing some of the issues with long-term mental health issues. I've been fortunate to work in mental health over the years in different guises, and unfortunately some of these things haven't actually changed in about 30 years. There's still a major stigma for people having mental illness. There's still a whole range of accommodation issues for people who have mental health problems. They can't access it, they can't keep it, and it's not appropriate for them, or it's too expensive. They tend to have a higher range of chronic disease and associated issues with smoking and alcohol, and they tend to have limited access to transport and difficulty accessing services, those type of things. And as we know, there's also an incidence of suicidal and self-harming behaviour, which is very challenging for local communities. Another key challenge in the Wheatbelt, there's some good stuff coming. And one of the key challenges is the ageing infrastructure. So part of what the Southern Inland Health Initiative project has been doing is actually putting in about $325 million across the CyHi catchment, which is bigger than the Wheatbelt, but the bulk of the resources going into the Wheatbelt, to actually help develop about 30 hospitals, nursing posts and community health centres. And one of the big challenges is these are old buildings, often requiring a lot of infrastructure and upgrades, which are needing to be delivered to actually meet basic safety standards or OSH standards or access issues or a disability ramp and things like that. So all those sort of issues are currently being addressed as part of the CyHi project across the Wheatbelt now. Workforce, attraction and retention of workforce. We have a major challenge in attracting and retaining workforce, but saying that, it has sort of stabilised in a little while, and some of the initiatives that I'm going to talk about shortly with the CyHi project have helped attract and retain people, particularly general practitioners. And what we're hearing from staff is that they actually feel safer to stay here now. They want to come, and the turnover has significantly reduced. One of the other big challenges in retaining staff is that the nature of the business changes, and so people who may have been able to do something on their own independently for some years in a small hospital, the risks of them continuing to provide that service, such as delivering a baby, say, is just outweighs the benefit. And so we have to sort of make decisions about where we do things like maternity services, surgical services, those type of things. So people would like it never to change, but unfortunately it does. So how's WACS responding to these challenges? Part of what the CyHi project is about, it's all about reform. And I think Minister Redmond spoke about that as well this morning, about the importance of reforming for the future, not for the past. So one of my challenges as a planner and a project director is to help people see that when we're doing planning work, we're not actually planning for what they used to do, but we're planning for what they need to do. And we base all of our work on need as opposed to want, which is often a real challenge when you're talking about these things in the community. We're providing more primary healthcare services, a whole range of new technology, which I'll go into in more detail, a real focus on chronic disease, a lot of work with infrastructure, and as I said, lots of partnerships. This is the key infrastructure developments that is occurring across the Wheatbelt. This isn't just CyHi money, this is also combined with a bit of WA Health money and a bit of Commonwealth money. But you can see there's significant amounts of money being spent at the 3 major hospitals across the Wheatbelt. Now, this is all about improving the emergency department, improving the ambulatory healthcare services, which is like the outpatient type services. In some places, cancer services, renal dialysis type services. The easy part is building the building. The hard part is maintaining the service, getting the right staff, making sure the mix of staff is there, and it's a very safe place. There's also $108 million being spent on small hospitals and nursing posts, and that includes part of some small sites in the Central Great Southern as well. Probably one of the more challenging projects that we're involved in and engaged with is the what we call CyHi Stream 3, which is about converting small hospitals into primary healthcare centres. And this is a project that's been going since we began about 3 years ago, and we're working very closely with the Cundin and Pingelly Shires, who nominated to be involved, where we're working with that community, those staff, that shire, that hospital, to convert their small hospital into a primary health care service, which means that we'll basically change the complete configuration of the health service to provide what people need, as opposed to what they used to have, which was a hospital which cost a lot of money to run with very few acute patients. Now, it's not an easy task, it's actually been a difficult task because it's all about change and reform, but it has delivered some good responses already, and already we've got the staff at some of the sites actually out there doing more community-based work, hospital in the home, community nursing type work, in anticipation of us winding down and changing the function of that small hospital. The CyHi project's also brought us $35 million worth of investment in telehealth over the 5-year period. And you can see there some of the actual, what we've been able to do is there's now over 110 outpatient telehealth locations across WA. So this is bigger than the Wheatbelt, it's across Western Australia. We've had over 3,500 outpatient consultations, and we've been introducing a whole range of new specialties, particularly consultants, medical consultants, and doing things that actually helps reduce people's need to travel for outpatient activity or pre-admission activity, or having to go back for an outpatient appointment and they'll drive all the way to Perth, spend 2 hours in a queue, see a doctor for 10 minutes and then go home again. What we're able to do with telehealth is actually plan all that using video conference technology, high definition. It's like being on a digital TV. But probably the core thing that's made the biggest change is the emergency telehealth service. There's now 40 sites across the state who are having the emergency telehealth service, and what that is we're using emergency department physicians based in Perth. They beam into the emergency department, work with the local nurses and GPs to provide high-level, specialist-led care when people are in an emergency situation. We estimate we know there's been about 5 people whose lives have been directly saved by the emergency telehealth service, and over 9,000 patients have been seen. And that's been going since August 2012. Now, this project will continue to expand across the state. It's quite unique, and it's being looked upon as being a saviour for how we can actually continue to provide high care, good quality emergency care into country WA. There's also a whole range of primary healthcare programs. These are being delivered across the Wheatbelt and the Great Southern, and they include things like a focus on people who've got 3 chronic diseases all at once. So we provide a real intensive case management service to actually keep that person well, living in their own home, that sort of thing. A whole range of things like introducing nurse practitioners into the system, diabetes education, aged care, a whole range of things that were based on what the communities identified and needed when we did a whole lot of planning right at the beginning of the project. And probably the centrepiece of the CyHi project has been the $182 million over 5 years across the whole of the catchment, which is the Wheatbelt's the centre of it, but across 5 different health regions, where we're investing funds to actually attract and retain GPs into the system, and also nurse practitioners and a whole range of other people. This model has been about actually invigorating and getting the critical mass of GPs into the system, but also about building up the emergency department network so that it actually is sustainable. So far, across the whole catchment area, there's 94 GPs who are receiving incentives to come and stay and work here, and many of them have already, there's 41 of those who are in the Wheatbelt. There's been 42 new GPs recruited and 25 of those are in the Wheatbelt. It's been quite a significant success in many ways, but it's also opened up a whole range of challenges for us because GP business is actually Commonwealth. So the state has chosen to invest in this to actually make sure that we were able to provide safe, regular health services. Prior to CyHi, there were many a day on the weekend from Southern Cross to Perth where there was no doctor on duty on the highway. Now there's 24/7 emergency care backed up by the emergency telehealth service. It's working. And the last part of CyHi, which we're just about to kick off, is a $20 million worth of investment to work with with the aged care sector to develop a whole new range of different ways to provide residential aged care which doesn't have a nursing home type service. And that's sort of something that we're currently underway and developing at the moment. So the future plans. There's a whole new range of models of care which is the way we provide service. Lots of ongoing improvements to ICT. Technology is the future for health. The way we deliver health services will be using video conferencing, e-health, those type of services, and it works. When you talk to patients about it who have experienced it, they really like it. They don't have to travel. They're able to see their doctor, their specialist in real time. The imaging is fantastic. You can actually look down someone's throat at their tonsils. You can undo a dressing and check and actually see what it looks like with great detail. It's quite amazing. A real focus on patient rehabilitation and recovery, and by that it's the sort of thing like what's called subacute care, which is about the step-down type of model where people might come out of Perth and be able to have a smaller, shorter admission in one of the smaller hospitals. A whole range of standardisation and things like that. So basically there's a whole lot of work going on in the Wheatbelt. It's pretty exciting. It's really exciting to be part of it, and I think what you'll see over the next few years is this sort of preliminary service reform work bedding in, making a big difference. And already we know that lots of people actually having the improvements to care locally is significant. Lots more people actually having care here, whereas before they used to have to go to Perth. So thank you very much.